Hi, this is Cece Doucette, Director of Massachusetts for Safe Technology and the international nonprofit Wireless Education, where we offer online training in about a half an hour to teach wireless risks and safer technology solutions. I'd like to thank our host today, WCCA TV in Worcester, Massachusetts, for giving this half hour together with you today. My guest today is a medical doctor who has been a pioneer in the environmental medicine field. Her name is Dr. Cece Nagy, and she has an environmental medicine practice here on Martha's Vineyard in Massachusetts. Dr. Nagy is Cornell trained. She has her board licensing in emergency medicine, and she herself has come up against the harm that comes from environmental exposures, including electromagnetic radiation exposures and mold toxicity. So please join us in welcoming Dr. Cece Nagy from Martha's Vineyard.
Thanks very much for having me, Cece.
You're very welcome. So Lisa, if you wouldn't mind, can you share with us how you even figured out that the illnesses that you were experiencing were related to things in the environment that were taking down your health?
Well, I guess it was a bit of a long journey because I'm a traditionally trained physician, and sometimes that makes it worse and harder to find help than if you're a lay person. So I was in California living in a house that I'd purchased a few years earlier, and I started having difficulty moving around quickly. I was kind of wearing a bathrobe, and the hot weather bothered me. I really couldn't get out of bed easily. I thought I was depressed. I labeled myself as having a psychiatric issue. And it turned out I had Addison's disease that was undiagnosed my whole life. And Addison's makes you tired, depressed, and fatigued, and low blood pressure, and you crave salt and sugar. So I got treated for that and diagnosed eventually. But not everything was fixed. And it turned out that the house made the Addisons worse acutely. And it made me have something else called postural tachycardia. So I stood up and my heart would beat quickly because I had nerve damage. And then it turned out I went to a clinic maybe a year later in Dallas, and everybody smelled my clothes and said I smelled moldy. And they all told me that it's the mold making you sick, as did the laboratory testing that I did there on urine and blood for mold antibodies and mold toxins. It turned out that house had a Walt Disney aquarium that was 5,000 gallons attached to the living room. And the doctor who built that into the living room wall covered up the air intake for the house from the shed. So the fish shed poisoned him. Then we bought the house and it poisoned us. And it took me a long time to figure it out because I'd sold the house and moved along, and I was in a rental. And then in Texas, basically, I learned my diagnosis, and it was called environmental illness from mold exposure.
Wow. And so did that environmental illness from mold exposure also cause your system to be unable to handle other environmental exposures like radio frequency radiation?
Right. So it's pretty interesting that I didn't understand that mold exposure often will lead to chemical sensitivity. And that means you don't like diesel, perfume, lots of exposures to foods. You become sensitive to foods, and shampoo and traditional detergent and fabric softener and those sheets. But it also, in 30% of those people who are chemically sensitive, can cause electrical sensitivity. So I wouldn't have believed it, right? Because, I wouldn't believe that I would be sensitive to holding the cell phone. And then the cell phone was heating up in my hand. I couldn't hold it. And the earbud was just too hot in my ear. And I had 4 computer monitors, those big CRTs, set up in a room in California the year previous. And when I would boot up, I would feel bad because I had so much radiation in one room, kind of bouncing around the walls. And then my hand touching the computer mouse would hurt. So I put the computer mouse on the floor and was clicking with my foot because Google didn't exist then, but probably, some research engine was there. And I was trying to research what was wrong with me. and I clicked with my toe. So it's pretty funny what you'll do to avoid pain, like, almost like a rat in a box. Mm-hmm. And that's sort of the beginning of my electrical sensitivity. But what's fascinating really is that in Dallas, in the airport on the way for treatment in 2003, I turned on the cell phone and I was asking about some medical results, and I started getting stroke symptoms. And I went out for a taxi to the taxi stand and had like a Hostess cupcake and a Diet Coke, very healthy. And I said, if I'm going to have a stroke, I'll sit still at the taxi stand. And the symptoms went away. And then I got in the taxi and I turned on the cell phone again, and I got stroke symptoms again. So I didn't put it together until the third time. And then I turned the phone off, turned the phone back on, got the feeling of extreme dizziness. And I later lecture on this and talk about in PET scanning in the Journal of Cerebral Blood Flow, like now 15 years ago, it shows that you have slower blood flow in the brain when the cell phone is on. And that's what was happening to me. And they call it rouleau formation. When you have the flow of the blood cells is not as fluid as it was. And so this is probably why the blood flow slows down, because it's electrostatic charges of each red cell with the next red cell floating through your blood vessels. And in the brain, if the vessels are very small and you're getting older, that you might get stroke symptoms. And that's how I explain it to people. So I went through that, and it was pretty scary. And if I can mention one last symptom that's really quite amazing. When I went to the clinic for my appointment, they took me to the lab and they said, here, sit down and we'll draw your blood. And there was a centrifuge spinning. And as I stepped forward, my arm and leg on the right side went limp. And I backed up and it went back to normal.
So was that the magnetic field that you stepped into?
So a centrifuge is spinning, creating a magnetic field. And it turns out I'm very sensitive to magnetic fields. So the technician just turned off the centrifuge and said, oh, you're just electrically sensitive. And I'm like, what is she talking about? So, I was the last person to believe or understand any of this, but I got it. And other people who don't like the subjects, it doesn't prevent them from getting it. So I've had friends and relatives get the syndrome, even though they didn't buy into it. And now they're sorry they weren't more careful about the use of their cell phone and their computer, because you need to stay away from those devices once you become sensitive a little, or you'll get the full-blown syndrome.
Right. And, Lisa, I'm so grateful you're here today, because education is really the crux of it. We can only lead a horse to water. We can't make them drink, but we can teach how easy it is to choose safe technology. On the back of everybody's router, there's an Ethernet port. All you need to do is plug an Ethernet cable back in. And some devices don't have an Ethernet jack in them on, the device level. But like with this little lightning adapter for the iPhone, it's all fixable. So you just plug things in, go into each one of your devices and go into settings and turn off all the
I have one right here.
antennas. And there you go.
These things are easily available if you get the name of it off of your website.
Yeah.
And even the new laptops, they don't really have a USB port or,
Yeah, for my daughter's MacBook, my daughters use the Thunderbolt adapter for their MacBooks. So again, we have solutions for everything. And if folks go out to Massachusetts for Safe Technology and you go to our resources page, you will find a lot of good information to help you through this at the personal device level, as well as for your community and how to strengthen your zoning bylaws so that they can't put a cell tower in your front yard or your backyard. That, your own devices you can control, but once that infrastructure goes in at close range, we're in big trouble. So there's a lot of incredible work going on all around the country and the world today to make our decision makers aware not only of the economic benefit of technology, but the biological risk factors. So we're so grateful to be able to help get that information out to the public. Lisa, you and I collaborated a couple years ago following in the footsteps of Dr. Cindy Russell, who was the first in the United States to work with her state-level medical association to start addressing EMFs, or these electromagnetic fields of radio frequency and other forms of man-made radiation. Can you tell us about that journey and what it took to get the attention of the Massachusetts Medical Society?
Well, it was Dr. Ray's idea, talking to Lynn Patrick, who's a brilliant naturopathic educator in this area, to put together a meeting, because she's very good at doing meetings. And then he passed away, and I was asked to sort of take his place as an MD, helping to co-chair that first meeting on electrical exposure, or, radio frequency radiation in
And that
California.
was the 2019 EMF Medical Conference, which offered,
Right.
I think, 18 continuing medical education credits. So that in itself was groundbreaking. So that's where you met Dr. Lynn Patrick. And just to say, Dr. Bill Ray initiated environmental medicine out at that Dallas clinic that you went to for healing. So that's how you knew Dr. Ray, and you became a mentee of his, right?
Right. And before him, there were people in the 40s and 50s and 60s, and Dr. Wrinkle was the allergist. Dr. Randolph is the father of environmental medicine, who treated Ray.
Okay.
And Ray, thinks he had pesticide exposure. I think everybody has a little mold exposure, to tell you the truth. He had a ranch in Texas. And his children, Dr. Ray's children, some were affected and some were not. And Dr. Ray had to live outside. And the children and the wife lived inside. One child lived outside. So they were so sensitive to indoor environments and chemicals produced by carpeting and building materials that they had to live outside in fresh air. And I live on Martha's Vineyard because I moved here for the ocean. And I survived because I left Los Angeles, where the total load of pollutants in the air was too much for somebody like me to handle. And many people don't realize why they feel so much better at the ocean. And whether they're in an environment where the ozone is high and it's hot, like this summer, they will feel bad. And the treatment is to go to the water. So, in terms of, the question that you asked, I should address that. The Medical Society of Massachusetts has been tolerating my resolutions for 13 years. And I had a resolution recently, 2 years ago, 1.5 years ago, on EMF and whether cell phones and cell towers and Wi-Fi is safe. And it actually passed that we don't know. We should reevaluate it. The question is, who's going to pay to reevaluate it? So Linda Birnbaum at the NTP had a $25 million study on rats and showed that cell phones can create certain heart tumors and other pathology in rats, but they're not asking the rat, let's say, how do they feel? Do you feel tired? Do you feel agitated? Are you having insomnia? So really, I deal with not only the brain tumor issue, but the how do you feel issue. And I feel bad when I'm near technology sometimes. Fluorescent lights make a lot of people feel bad, for example, and that's EMF sensitivity. So if 70% of women over 40 are mildly environmentally sensitive or even severely, and 30% are electrically sensitive, that means a huge proportion of the population could be electrically sensitive and doesn't even realize it. They just want to hang up the phone. They don't like being on the telephone, whether it's a landline or a cell phone. People have different sensitivities to different frequencies. And the Medical Society and other groups of doctors are often very slow, like 10 or 20 years behind the public. So what we find is that people believe these things, but the medical societies or the physician in the office has no knowledge about it, unless somebody like me or Cindy is sort of waving the banner of precaution. We don't know if these things are safe. And I don't know if anybody cares until they get it. So I care because I got sick.
Yeah, I like to think it's a lot like where we were with Lyme disease about a decade ago, where so many of the doctors had never been trained on it, and many of them were referring patients for psych evaluations instead of addressing the physiological symptoms that they were experiencing. So we were very fortunate to have that first medical conference that you co-chaired, and then Elizabeth Kelly and others did the subsequent EMF medical conference. That just expired in June. But we are so grateful to Dr. Panagopoulos out of Greece and his colleagues, because we now have the first medical school textbook so that we can begin training doctors and nurses. This is called Electromagnetic Fields of Wireless Communications, Biological and Health Effects. And the environmental health nurses have also added a new chapter to their textbook so that the nurses can get the training that they need. So if folks go out to Massachusetts for Safe Technology on our resources page, you'll be able to access these publications that you can bring to your doctor. Lisa, are there other resources that if somebody suspects maybe I really am environmentally sensitive or maybe I have electromagnetic illness, what other resources can they bring to open a credible conversation with their doctors who are going to need to run some tests on them to validate what might actually be happening in their bodies?
Well, I don't want to be cynical, but I was going to mention, I spoke at the AMWA meeting in April, which is the American Medical Women's Association. It's like the AMA for women. And there I gave a talk called Women's Health is Environmental Health. And it was a small talk, 100 people, but the group is very large. And one of the members of the audience was a curriculum chairman and asked me to put together a medical school course on environmental medicine. And the idea would be 160 hours. Medical students could add this as an elective. And then the course would be recorded for all other medical schools to be able to use or purchase, or whoever owns the rights to it. And I would like to see experts in all of these different fields giving lectures. So I would talk about how to treat a patient, step A, B, C, and D. They come in, you ask them these questions, you do these tests. The problem is you can't take a GP and make them into an environmental doctor by handing them a book. They don't have time. They don't have the interest. I have a flyer that's a page, a very dense page, and it's on my website. So it's lisaнаgy.com, and one-page flyer. People could download that and bring it to their doctor because it has do's and don'ts. Stay away from scented products. Stay away from pesticides. Don't sleep with your cell phone on, turn off the clock radio. Basic things that people can handle. If you give them too much information, they get overwhelmed. The doctor's overwhelmed. Often the doctors are environmentally ill. A lot of middle-aged women who are in medicine don't even know they're chemically sensitive. So we've got this problem where we're trying to make the population of physicians help the public. And really, they need to lean in and say, here's the flyer. You don't need a psychiatrist, or you just need a therapist to guide you as you do this traditional environmental medicine treatment. But it's hard to make them be an allergist or know about the rotational diet or know about hormone management, know about all these things I've learned, the use of oxygen for 2 hours a day, of sauna. It's complicated to do it,
So, Lisa, I know you've also served on the board of the American Academy of Environmental Medicine. And last I checked, they have a directory of physicians who are trained in environmental medicine. Is that a website that you recommend patients can go to try and see if there's somebody within driving range or maybe telemedicine that they can consult with if there's nobody in their local area who really understands the gamut of treatment that may need to be applied if there are things in the environment making them sick?
Yes, it's aaemonline.org, and they list and I really believe in education and treatment for the poor, and that means that Medicaid and Medicare should be reimbursing for like the allergy testing method called provocation and neutralization that we do. And, there's a very good naturopathic group that does environmental medicine as well. So one of those two groups will have lists of physicians and naturopaths that can help people. I feel like the videos are free. So, if you go to my website or the Academy's website, you can learn a lot without spending any money. Then you decide where you're going to go. It's not going to be in your hometown. It's going to be somewhere else. If you're very sick, you're going to need to travel, and you might need to be treated for weeks or months. But I say somebody can come for a couple of days, and then it's legal to treat them over the phone thereafter. If they wanted to come, let's say, to my practice in Martha's Vineyard, because I do adrenal assessment called ACTH stimulation testing on the second day. And if you do have low cortisol, it's life-threatening. And you need to know if your adrenals are wiped out from the stress of your exposure. And that's step one. Step two is postural tachycardia and looking for that fast heartbeat, standing versus lying down, if it's 20 or 30 beats faster. And, I'm not sure how much time we have, but I'm just going to say a sentence. A lot of the problem, let's say, of Martha's Vineyard and the teenagers with mental illness and addiction has to do with the moldy buildings here. It has damaged these parts of their endocrine and nervous system. Everybody thinks that they're just, anxious and need psychiatric drugs. And this is crazy. They need physical assessment. Urine and blood can show that they're mold exposed. The Wi-Fi in the schools should be minimized, and they should have hardwiring of the computers, because if you have moldy kids with Wi-Fi on top, they don't really have a chance to do very well. Some of them won't make it to college. They'll be lying down because of the postural tachycardia, and COVID causes this similar thing. So if they had to have COVID, or the COVID vaccination has made them worse, this is not controversial. It's in a JAMA article about these conditions now being exacerbated by COVID. So if we don't look at what's really going on with the scientific literature, and we guess and just call people hysterical, that's not a mature way of practicing medicine.
Right. And Lisa, I was thinking about you on the drive in today. I was listening to the public radio station, and I guess a report has just come out this month that indicated we are seeing higher opioid deaths than we've ever seen before. And I know that in the past you've indicated that when you have a body that's hitting this tipping point with illness and environmental exposures, as Dr. Andrew Goldworthy put it one time, our bodies, our physiological cells only have so much energy, and they're pretty well calibrated to get us through the regular energy, that we need to get through our day. And then when you add an environmental exposure into this, and then like mold, and then you add another one like wireless, then our bodies don't have enough to keep up. And so we start seeing this domino effect of the many symptoms that you've described. And several of the papers that I read during the pandemic said one opportunity that the Centers for Disease Control missed is that there's usually 3 prongs to treating a pandemic. One is you look at the virus, COVID-19 in this case. 2, you look at the host or the person who's got it. And then 3, you assess the environment to see what else is taxing the person's immune system. And here in the U.S., we didn't pay attention to the environmental exposures as we continued to hand wireless tablets to every one of our children to access their education, and added this additional stressor with not one shred of safety information. So I think I'm just so grateful to our environmental physicians and nurses and others in the healthcare industry that are trying to bring this mainstream. And I know you've been knocking on doors for so many years, but you planted so many seeds, and you actually get a lot of heavy hitters that are listening to you today. So I'm so very grateful for that. And I know Dr. Linda Birnbaum, as you mentioned, retired in recent years from the National Institutes of Environmental Health Medicine, which I think basically says she was one of our country's top scientists. And it was her group that did that $30 million National Toxicology Program study that determined clear evidence of cancers and DNA damage. And that should have triggered public policy to start protecting us. And in another interview that Dr. Birnbaum did with Andre Fateau up in Canada, she said there are definitely some captured agencies, captured by industry, so our FCC, our FDA, and others in certain areas are definitely doing the industry's bidding instead of protecting our public health and safety. And so she said there are definitely still some really good people in our federal agencies, so we don't want to throw the baby out with the bathwater. But she said it's likely going to take pressure from the bottom at the local and the state level to rise to get the federal level to do their job. And so I wanted to give a shout out to your senator in the Cape and the Islands here in Massachusetts, Senator Julian Cyr, who used to be the liaison from our Department of Public Health to the State House before he was a senator. And when he got into office, he introduced a couple of bills to form a commission to investigate this wireless radiation issue and then see what we can do about it. Now, when his bills first went through, the Joint Committee on Consumer Protection looked at them and said, "What is this?" and assigned a research analyst, and we were able to provide input. And Lisa, you came down to the State House and testified with us, which was fantastic. And you know, I never in a million years imagined I would be doing work with our legislators. That just was never anything I had even come close to. So I thought the only thing that could happen with these bills is, one, they advance it to the next committee, or two, they send it to study, which means it kind of goes to the graveyard and nothing more gets done on it. But what this Consumer Protection Committee did is they actually wrote their own bill to say we need to form a commission, and we need to get not only the legislators and the doctors and the Department of Education and the industry to the table. Let's all get on this and see what we can do. So the Joint Committee on Consumer Protection and Professional Licensure actually wrote this bill that Senator Sear has now brought back for a couple additional sessions, and we've gotten it reported out of the first committee favorably a few times. But we have yet to do what New Hampshire did, which is to pass a law, investigate, and come out with a commission report that outlines the steps that the Commonwealth of Massachusetts would need to do. But we have an opportunity on Monday. By the time this airs, this will be past tense, but this coming Monday, the hearing is now scheduled for the Joint Committee on Public Health, so we hope you'll be able to either send in written testimony or also come on and speak with us by their teleconference opportunity. So thank you for showing up time and again, Lisa. We're so inspired by the work that you do and the patients that you help every day. We need so many more like you. So I hope people will go to Lisa Nagy. It actually sounds like Nagy. LisaNagy.com. You can get to her website there and learn more about her practice and the resources she has to share. Or you can go to Massachusetts for Safe Technology. And I just want to remind everybody that we do free public education training every month. And doctors and nurses and firefighters and first responders, they can come too and just get a basic overview. So then they'll know what to do when they go looking for the language that they relate to in their medical training. So, Lisa, thank you so very much for being with us today. And we look forward to next time. And have a tech-safe day, everybody. Take precautions, hardwire, and turn off the antennas. Thank you.
Thank you.